My name is Abby Hess, and I am a nurse practitioner, a clinical researcher, and an entrepreneur. So, as a nurse practitioner with the Department of Anesthesiology, I see patients prior to them undergoing anesthesia and having surgery. As a clinical researcher, my focus is on preoperative anxiety reduction for pediatric patients. My third role is an entrepreneur. So many people are familiar with entrepreneurs, people who go out and start their own companies or businesses. As an entrepreneur, I get to lead innovation from within the company where I already work. So in this role, I've actually gotten to develop a new medical product in collaboration with my hospital's commercialization department. And I really love having three separate but connected roles because I get to care for patients, identify challenges in the clinical setting, and develop solutions through innovation and research. So my nursing journey, my career actually did not start off in nursing. I studied psychology and biology in undergraduate at Centre College, and I really knew I wanted to do something in patient care and healthcare, but I didn't know what career pathway was the best fit. So after I graduated from Centre College, I was offered a job working as a research assistant in a laboratory at Cincinnati Children's Hospital. And I love getting to work in the research laboratory because I got to learn a lot about the scientific process in medical research. And at the same time, I was able to explore different career pathways in the medical field. And when I had the opportunity to meet nurses and then shadow a nurse practitioner, I quickly realized this was exactly where I belonged. I love the role that nurses have in patient care, but also the wide variety of career opportunities in the nursing profession that can help improve care. And I think both of these things are really what drew me to the profession. This all really started with an idea from the bedside. In my role as a nurse practitioner, I see patients prior to surgery, and oftentimes we get children in our anesthesia pre-op clinic who are just so scared to go back to the operating room and have surgery. And the highest point of anxiety oftentimes is when we put a mask on the child's face to have them breathe anesthesia gases and go off to sleep. And studies have shown that kids who have high anxiety in this moment during anesthesia induction when they're breathing gases through a mask, these kids actually are more likely to have poorer outcomes after surgery. And so thinking about this challenge through the eyes of a child, I really wondered if we could find a way to make breathing gases through an anesthesia mask easier by adding some element of fun. And what I really envisioned, just knowing that kids, how much they like technology and engage with video games, I imagined potentially having a breathing controlled video game app. So when kids put on the anesthesia mask and breathe, that would actually control a video game and give them something really fun and kind of immersive to engage with as they're learning about going to sleep with anesthesia and then as they're actually falling asleep. And so the goal was to really transform a scary anesthesia mask into just a fun game controller to help kids with this process. I had never done anything in product development, so initially I didn't even know where to start with this idea. But then one day I was having a conversation with my research mentor, and I shared this idea of this breathing controlled video game app. And I shared that really every day in the clinic, I saw kids who could benefit from this idea. And he told me that he thought this idea was incredible and that we really would need to find a way to get this funded so that we could move it forward. And so several months later, I was able to partner with colleagues who had expertise in product development and commercialization to write an innovation grant. So I didn't really know how to write this type of grant when I first started working on it, but being able to partner with colleagues who had expertise in this area was what made that possible. And we ended up being awarded this grant for $100,000. This grant allowed my team to work with designers and computer programmers and engineers, and this allowed us to create the first prototype of this breathing controlled app for anesthesia induction. So several years later and several grants later, we're close to product commercialization, and that's really so that we could make this product available to any patient who could benefit. I am super passionate about encouraging nurses to both be engaged in product development, but also just really kind of understand the process. Nurses work with medical products every single day, and so we really intuitively understand the strengths and the weaknesses of the products that we use. And these observations that nurses have about products are really critical insights that are needed to improve existing products and to create new innovative products that can help improve outcomes for our patients. I think as more nurses start to see their insights as valuable for product innovation, and we create more pathways for nurses to drive their ideas forward, definitely I think we'll see less frustration from staff from products that don't work as well as we would like them to. But most importantly, I think when nurses are really engaged in this product development process, we'll see improved outcomes for our patients. 4 things I would recommend for nurses who are thinking about developing an innovative product. The first thing I would say is really believe in yourself and your idea. Your experience from the bedside and your ideas have tremendous value and really can help improve healthcare outcomes for your patients. And the ideas that you have and the problems that you see, these are probably problems that other places are also facing. And so things that you come up with, these really may be useful for people far beyond your institution. The second thing I would say is be persistent and flexible. There's not necessarily one single pathway that will get an idea into practice. And there will be lots of unexpected twists and turns along the journey to product development. It's a marathon, not a sprint. And there's always, sort of unexpected things that come up, lots of problem solving to sort of get you from the beginning to the end of the journey. So I think being persistent, will really help you get there. The third thing I would say, find people who have done this type of work who can help mentor and support you. Sometimes this exists within your own institution, but sometimes you have to be kind of bold and reach out to people who you've never met. Across my innovation journey, I've connected with people, through LinkedIn, through Twitter, through conferences, sometimes even just through reading an article and then reaching out to the author and saying, this is really fascinating. Would you be willing to share a little bit more? Because I'm working on innovation also. I've really found that nurses working in innovation are super passionate about helping other nurses to bring their innovative ideas to life. And so don't be afraid to reach out to people. And I'm always happy to talk with nurse innovators. The fourth thing I would say is look for resources that are made for nurse innovators. A couple years ago, there weren't as many of these super readily available and accessible, but now there's a lot. The Nursing Now Challenge is one. The American Nurses Association is putting together lots of resources and has a website dedicated to nurse innovation. SONCL, which is the Society of Nurse Innovators, Entrepreneurs, and Leaders, has lots of different resources as well, and Johnson & Johnson. So we can share these on the website so you can check out more of these different resources, but there's lots of great places to get started and learn more about nursing innovation. What I've learned with innovation throughout the process is that it takes so many different specialties to bring a product from an idea to market. So with innovation work, my mentors and role models have been nurses, doctors, PhD scientists, designers, engineers, entrepreneurs. And I think that's one of the coolest things about this journey is really getting to meet all of these different people, to learn from them, and to be able to come together to create something totally new. 2 nurse innovation role models who are really inspiring the next steps in my career are Dr. Oriana Badet and Hiam Nadel. Oriana Badet is the Vice President of Innovation at the American Nurses Association. One of the many things that she's leading is the Innovation Advisory Committee for Nursing. And this is a group of nurse innovators who are coming together to really reimagine and create the future of the nursing profession. And so I'm getting to work with Oriana as a part of this committee. And in one word, getting to work with her is just amazing. She's such an inspiring and visionary leader, and I'm just learning so much about innovation and the type of leader that I want to be. Hiam Nadell is the director for the Center for Innovations in Care Delivery at Massachusetts General Hospital. And she's really focusing on how we can translate ideas from the bedside into solutions that we can use in clinical practice. And she's creating the structure and resources and mentorship for bedside clinicians to really empower them to be able to do this work. And so I am just so inspired by Hiam's work, and she is just such an amazing leader in person. I'm currently partnering with a great company called Little Seed, and we're working with them to develop the commercial version of the breathing controlled video game app for anesthesia induction. We're already using the product in routine practice at my hospital, and we're planning to launch the product in 2022. So I'm super excited to be at this point in this product development journey. Going forward, like Hiam Nadell, I'm really interested in building structure to help nurses translate ideas from the bedside into solutions in the hospital setting. I'm really fascinated by how the intersection of research, quality improvement, and innovation can help facilitate this. So these are all areas where I'm continuing to gain additional training and to grow. Getting to see all of the different roles and skill sets that nurses have, I really believe that the sky is the limit in terms of how nurse innovators can transform healthcare. I think one of the most important things that I've learned from this journey is that you really have to embrace your incredible skill sets and characteristics that you possess as a nurse and work to grow them to become a nurse innovation leader. Because it's your knowledge from the bedside, your passion, and your great ideas that will build a bright future for our healthcare system.